Thank you, Dr. Lucasey, Dan, for inviting me. I've been learning so much from my colleagues, Dr. Bill Barley and Dr. Elyaman. I'm just so excited to be joining you today. My presentation is entitled Stable and Abundant, Now and Onward, What You Need to Know for Yourself and Your Business. So I'm the section of this concurrent offering, which is addressing cash practice, fee for service. And during this pandemic, we've actually had initially a reduction of 50% of our income, and we're really doing well now. And I wanted to share with you how we've made our way forward. Thanks for joining me. This is a poem by John Donahue, which I wanted to share. I think this is really important for healthcare providers, for me, for you to be treated well. Like the joy of the sea coming home to shore, may the relief of laughter rinse your soul. As the wind loves to call things to dance, may your gravity be lightened by grace. Like the dignity of moonlight restoring the earth, may your thoughts incline with reverence and respect. As the water takes whatever shape it is in, so free may you be who you become. As silence smiles on the other side of what's said, may your sense of irony bring perspective. As time remains free of all that it frames, may your mind stay clear of all it names. May your prayer of listening deepen enough to hear in the depths the laughter of God. So you may be feeling a little bit like a fish out of water, and we're being asked to breathe for the first time. So I will join you there today. This is the foundation for our self-care programs, our Honor Self curriculum for healthcare providers, and my own personal aspirations, which I work to embody, is this. My work is to discover personal ease, space and relaxation, mental wholeness, emotional safety, and joy in this life for myself as my main job, so that I can then share it with others. Something I work to aspire to daily. A little bit about me. I've been a coach and a mentor. My first mentoring I offered in 2002, and I have a faculty role. I'm also fellowship trained in integrative medicine by the Andrew Weil Center of Integrative Medicine, and I have my IFMCP certification. You can learn a little bit more about me in that slide if you're interested in my background. So I wanted to share some about my personal journey. I have created a cash practice from no patients, my own bootstraps. As Dr. Barley said, I've earned my street cred, and I wanted to share how I've stumbled so that you can stumble less and realize your dreams much sooner. I agree with my colleagues that doing it your own way is essential. I'd like to share some resources with you, and I have a number of handouts that are provided to you. I'm going to go over some of them today. These are the handouts that I use for the mentoring clients that come to my practice to learn how to do a fee-for-service model in as easy and as successful way possible. We'll also talk a little bit about Honor Self curriculum, which is about what you need for yourself, not just what you need for your business, to address some internal barriers, which are really fundamental for success. And I'll invite you to our monthly free healthcare and integrative professionals event, which is my joy, my most favorite thing to do every month, which has been happening for the last 6 years. And I would love to see you there, where you can have a self-care experience. We'll talk a little bit also about the retreats and the virtual mentoring that we offer. So in terms of my journey, I was a yoga teacher and yoga therapist before I went into medicine. I had an Ayurveda certification prior to starting at UNC Med School as a Tar Heel. I have 3 immediate family members that have drunk the Kool-Aid, and we're all heels together, Tar Heels. And one of the ways that I maintained my own boundary, my own health, my mind, body, spirit balance during my medical training was I worked with someone who was a somatic specialist. She didn't just work with feelings, she worked a lot with the body. And I met with her every week and developed a very supportive and nurturing relationship with a therapeutic partner. And she helped me to keep a sense of myself, keep a sense of my body. And eventually she came to partner with me to offer my first Honor Self retreats. And so we're now colleagues. So I completed my residency in Philadelphia. So my practice is west of Philadelphia. And we are offering, we serve primary care needs of our patients, but we're considered specialty care and we're not on call. So in my residency, I completed a mindfulness-based stress reduction teacher certification. And that was one of the first ways, while I was still completing my fellowship and completing my IFM training, that I offered mindfulness as an 8-week class, skills training to all of my patients. I have been a medical director of integrative medicine in a large hospital network, and I've been doing a cash practice on my own for 11 years. The way that I started was I didn't go into debt. I actually was part-time doing revenue generation, doing more procedure-based medicine. I got certified. I had never done it before. I got certified as a wound care doctor, and I worked in nursing homes all over Pennsylvania with a lot of travel. And then I began my integrative practice, my functional medicine practice, 1 day a week. I advanced to 2 days and eventually to 3 days. And at 3 days, I stopped my revenue generating procedure-based income job. And what I would recommend to you is to really think about how to structure your business so that if you were to work 3 or 4 days a week, that would be enough to pay your bills. That has to do with how much you might charge for services and how you organize yourself. So one of the keys that I want to offer you today is about overhead. And I have just an example of a couple of weeks of my schedule. This was back when I was on my own and just had one virtual assistant when I got started. And I'd also say that the Small Business Association has free financial mentoring for you as a physician and to many professionals. And I would really recommend that if you don't already have your own expertise in business modeling, planning, being in touch with your profit and loss statement and your finances, it's especially important now to know what your numbers are in real time. I'd recommend that you look up the Small Business Association and you get some free mentoring from them. And they're a wonderful resource, which I've used since the beginning of my business. And I don't have an MBA, and I've learned a lot of it through trial and error. So this is an example of a clinic schedule, which is 3 days a week. You can see that the light blue and the dark blue are actually patient appointments. There's some follow-ups listed here, some new patient appointments. And for me, because I'm a faculty member, I need time for some teaching. And also I have some administrative role as the owner of the business. There are some Mondays and Thursdays, or actually 2 days a week are going to be non-clinic days, which are reserved for those other tasks. So if you have a lower overhead, then you need to work less. You don't have to work as hard to meet that overhead, as you all know. So this is just an example of how many people that I saw in a day when I had a low overhead with just one virtual assistant supporting me. So this is my team now. I have a beautiful team. I'm very proud of them. And we've had to make some changes in the pandemic. So we actually asked our team if there was anyone who wanted to work less, and 2 people took us up on that. And there was another part-time staff member that we actually asked to pause her work with us. And we're looking forward to having her back and being whole again. All of my providers are working slightly less. They're not working when they reduce their time. Some of them reduce their time by as much as losing 1 day additional a week, but no one is working more than, or they didn't change their schedule more than 1 day a week. And we shared it across the provider team. And I also took a pay cut, and I also let my staff know that I was also feeling and responding and being part of the changes that were needed. And we're really positioned well to be continuing to work in an easy, non-pressured way because we've made some changes that we need to make, and our team has had an extremely high morale throughout. So this is my team. We work telemedicine. We transitioned to telemedicine on March 13th. And we did it pretty seamlessly because my team just embraced. They're used to having to turn on a dime and make changes and figure things out, work together. And we went to telemedicine. We didn't miss one appointment. In the beginning, we were training our patients to understand how to click those Zoom links and how it works. But we have offered great care. And I really feel good about some of the advantages of offering telemedicine. And so when we do our mentoring now, we train other healthcare providers how to do virtual medicine, how to do telemedicine. So our mentoring specializes in that. And we are feeling excited about that new way that we can specialize in mentoring. So I wanted to share our mission. Thank you, Dr. Barley, for pointing out how important it is to know who you are. So our mission at Philadelphia Integrative Medicine is to empower, inspire change, and to create trust with our patients, our providers, and our own staff, and also to create trust with the functional medicine community and with ultimately the medical community at large. That's where we come from, and that's where we revisit our mission every day. So we offer the best of conventional alternative medicine to inspire and give the tools to care for yourself, to be well. And we talk to clinicians as well as providers about that mission. Our intention is to embody self-care and to also be financially accessible and sustainable. So this is a picture of the first Honor Self retreat that I ever offered in 2015. You can see that we were not all women. We had both men and women represented. And in this picture, I can actually circle her right here. This person right here is the therapeutic partner who assisted me in maintaining my integrity with myself, my connection with my body, my emotional health during my medical training, my 4 years of med school, 4 years of residency, 2 years of fellowship, and Onward. So she is here partnering with me. This is a picture of us all together on the first retreat that we offered when we were acting as colleagues now. So as a team, provider team right now at Philadelphia Integrative Medicine, we meditate daily as a staff. I happen to have a lot of yoga teachers on my team, and so they'll offer to lead meditation and also lead some movement. So we do that every morning at 8 o'clock, and we have a provider meeting prior to that when we talk about patient care, cases, and also the things that we're learning in the pearls, the clinical pearls. So that keeps us all on our toes. People are following different thought leaders. They're following different blogs. I learned so much from my providers. I like to surround myself with people who are smarter than me. And it really helps us keep us on the cutting edge. And then when we have mentors, so that means clinicians who are practicing, who come to us to learn how to apply functional medicine, they participate in those discussions actually twice a day. So just some information here that we do virtual mentoring and phone mentoring. And we have actually created a starter kit for the Honor Self curriculum. And what I'll do today is give you all of the elements of the starter kit. So normally people go to the website and there's a very small fee just to download the handouts, print them out, and just follow. I'll be giving you all the elements that you would need for your own starter kit. So there's different handouts that guide you through an assessment and also some tools that help to keep you as grounded and as centered as possible. Because as we know, if we're at the still point, we make good decisions and we work less. This is one of those first of those handouts. This is a blueprint that I created that is talking about what is the transition from thinking and treating conventionally to making the transition to functional medicine. So in this blueprint, we name the transition, we name the challenges, we name the solutions that we've come up with, and also what is the potential of really embodying some of these principles and actually practicing functional medicine. So you're not expected to read this. This is quite small, but you have this handout and you can print it. On this first slide, I'll just mention those categories again. What's different in functional medicine compared to conventional? That's that left category right over here. And what are the challenges that you experience? And I'll go over this as well with you. So one of the things we know about our field is that it's rapidly evolving. And didn't that evolution speed up times 10 in these last couple of months? So we are already moving fast, which is one of the reasons that I have a team and also that I can learn and grow in a community of providers. But our field is not only evolving, but the actual terrain is as well. So these are some solutions, and sometimes I'll actually go through an entire session just to talk about step by step what are the solutions to actually making the full transition to functional medicine. And some of that has to do with actually completing the transition and not straddling both worlds, practicing part-time conventionally and part-time in a functional medicine practice is very tough to do. Making that as short as possible so that you actually make the transition and take the leap, and seeing what the barriers are so that you can transition is one of the fundamental ways that we support our mentored clinicians. But there's lots of pieces here, not just committing. It has to do with learning roles for yourself, a different provider role, different patient role, learning to manage time. There's much here. And we have a section here on what is different about patient care and the solutions, and what's different for business model solutions. So learning how to be comfortable to promote yourself. And if you're not comfortable giving talks and being more public, finding the ways that you can compensate for that so that you can still get your message out and people can still find you. So there's certain pieces that need to be in place. So even if you don't do them like others, these are some key pieces that need to be attended to. And if there's any questions on this section, we can also do something in Q&A on what are the solutions and just quickly go through. The potential is for us to actually feel well, for us to feel relaxed, for us to be happy. And in general, I think that we can be a pretty stressed community. And I know my stress has gone up with the pandemic. And that means I need to rely on my community support, my personal support, and my tools. So I'll share some of those tools today so that you can see what you can do now to support yourself. So where do patients come from in a cash model? This is something that we've looked at consistently over the 10 to 11 years that I've been in practice and created my own model. So approximately half of the patients that we see come from the website, and I'll break that down because some of those website searches are actually looking for us by name, and some of them are looking for keywords. That's how we're found via the internet. A very large portion of where our new patients come from are patient and provider referrals. So that means fellow providers in the community. There could be a cardiologist, there could be a physical therapist, there could be other specialists, and even other primary care doctors who refer their patients to us or provider referrals. And our patients refer their parents, grandparents, their spouses, their children, their grandchildren, and we see many generations of a family over time, which is very gratifying and which we really appreciate. And one of the things we do is we give gifts and we give acknowledgments to our patients, and we encourage them and we ask them to refer new patients to us. Sometimes we're not reminding or expressing what our needs are as the practice. I'm growing my practice. We are growing our practice, and we invite new referrals and thanking people for supporting the growth of our practice. We also get 10% of our new patients from offering free community content, very content-rich group classes. I'll show you some examples of those. And those have been extremely helpful in sustaining and growing our practice in the pandemic, and I'll give you some of the specifics. So where do the patients come from when you're in a pandemic or you're recovering from a pandemic? And the answer is they come in the same proportions from the same sources. So one thing we do is we do quite a bit of tracking. So when we make a change, we test and see whether or not it's bearing fruit. So for example, if we do a gift certificate sale on $100 increments, and we do that for 1 week, we sold 61 gift certificates. We want to keep track of that and see what happens. So if we end up doing a percentage off a new patient appointment with my other providers, I happen to be booked for many months in advance. My next new patient appointment is or follow-up appointment. All my slots are full for a number of months, but my fellow providers have some openings, so we did a reduction in their first patient, like the new patient appointment. We track that and we see how many people took advantage. And we have an automated system for people to sign up for appointments and schedule themselves without having to have the call back and the phone tag to try and identify the right time for people to come in. So we've talked a little bit about these sources of referrals, and we keep track of, and we certainly did this in the pandemic, why did the patient cancel? Why did they not come in? Was it because they were concerned about the fact that it was telemedicine, they couldn't do it? Was it because they hadn't gotten their labs done because they're afraid to leave the house and they didn't want to come in until they had lab results? Was it for other reasons? And this has helped to inform our strategy so that we've been successful. So we do look at the schedule weekly, and we look at percentages of new and follow-up patients. We look at when we do a free consult, we offer a 15 to 20-minute free consultation, which is phone or Zoom right now, because we're a telemedicine practice. And we love telemedicine. We've learned so much, enjoy it so much. We keep track of what's the percentage of conversion for that free consult to turn into a patient who pays a deposit and then comes in for their first appointment. We take a look at our social media analytics. But as you can see, in terms of where our patients come from, you don't need to overdo and overwork this. Once you've got your patients and fellow community providers referring, and you've got your website set up for the correct search engine optimization, then you actually don't need to spend as much time on social media. You can use social media to promote your events, your free events, and then to draw in new people that way. It's very important also to know that I learned this the hard way. You want to have a wait list, and you want to cultivate that wait list and have it be a little bit big and bulging before you take that next step to offer that next day or expand that provider to the next step. And you want to have that wait list so that when you have cancellations, you can fill someone in that slot. And that's something that is true for every cash practice. That is an important pearl. That is how you fill your schedule and that you don't have empty slots. Because what matters is how many people you see per day, not what the schedule looked like last week, but did you actually provide care? Did that care take place? When we were in the office way back when we were in person, seeing people, hugging each other, touching each other, we gave little cards out and we chose our words carefully. And we said, thank you for trusting us. And it just communicated that we had the free consultations and that we're growing and that we appreciate referrals. And this was an easier way for staff and providers to communicate that you're an existing patient and you're a source of referrals. We appreciate you. And this is how we termed it. These are the words we chose for communication. So this is an important piece here. So following up. So when you have people and they have a webinar and they're excited about becoming part of your practice, you want to actually be able to make it easy for them to sign up. So we always have a follow-up email after a group class, and it has some content, but it really says this is how you click to get your free consult. You can schedule it yourself, and this is these are the providers. Here's their bio, and we just make it easy for people just to follow through. This is just some more information that we've covered. So in the pandemic specifically, what have we done? We offered weekly webinars for a period of time to check in with our patient base. And one of the reasons we did that was we wanted to actually find out what was the experience of our patients. And we did that through polling. So we did a series, and we actually contacted some industry sponsors to support us in getting the word out and also support us to provide these webinars, and we got much better at webinars. And the polling helped to inform next steps. We'd say, what topics are you interested? Do you still want to talk about COVID? Or do you want to go back to your functional medicine topics that we had scheduled for you before we went into the pandemic? Are you ready to go back? And that really helped us. In the first weeks of the pandemic, I was asked by our patient community to actually have a daily message. So I created a 3-minute video every day. I did 5 at a time, and then they were put up every day for just self-selecting group of patients that wanted to know that we're there, that they'll be okay, that they could have a healing message every day. They could make a connection, that they could look forward to the message because so many things were changing. We did this for a period of time. I enjoyed making the videos, and I enjoyed being asked for that connection and then being able to respond to that need. As Dr. Eliaman said, we want to assess that need. It's wonderful when people tell you what they need. This is a talk that we did recently. This is actually an old flyer. When we were going to offer this talk, we had to reschedule it because it was right after the pandemic started. So this is a talk on estrogen dominance, full of functional medicine content, all of the lifestyle, diet, and things you can do for yourself to balance your hormones. And we canceled it and we rescheduled it once our polling in the webinar showed us that people wanted this and they wanted to get back to this. So we actually did part 1. It was so much content, we actually had to divide it into 2 webinars, and we had 669 registrants and 180 attended. We had the best question and answer session we've ever had. And all our providers were present, my nutritionist, and my 2 fellow providers and myself. And we actually ran the webinar ourselves with someone who's trained on our own staff. So this was a really successful and heartening event. We also do something in person in the past, but now virtually, called a provider lunch. It's called a virtual provider lunch, where we find out who's gone virtual. Are they offering care? Are they waiting until they're in person again? We support our colleagues, and we nurture them. We find out how they are. And also when we refer patients, we sometimes will ask our own patient, is it okay if that referral provider contacts you first? And that also just makes sure that that referral provider knows that we're referring to them. Even if the person doesn't call, we did refer. And that helps that relationship and nurture that relationship. And this is a little bit about our monthly group that we've had for years and years and years. My favorite thing to do. You are a healthcare worker, and a healthcare worker, an integrated professional, is invited to come with me first Monday of the month in the morning, or you can sign up and then get the recording, and that's for your own self-care and growth. We have a theme, and that is a very nurturing experience, and I feel good for about 48 hours after I lead one of those. So quickly finishing up, one of the things that we do in mentoring, and one of the things we do for our own providers, is we recognize that crises are a time of opportunity. And when you are transitioning to functional medicine, it is a crisis of identity, financials, and a lot of change. So we offer some resources and wanted to share those. If you go to our website, Philadelphia Integrative Medicine is shortened to philly-im.com. There's lots of free resources there, and I'll tell you about those. So philly-im.com/providers. And it talks a little bit about retreats and talks about free resources, and we have an emphasis on virtual mentoring there. Just very briefly, the handouts that you have so that you can do some of this good work yourself and be as empowered and relaxed as possible at this time. This is an honor self-assessment, and it sort of has instructions. And one of my favorite questions here is, I respond to my body's needs. My body feels healthy. I have fun. I laugh, I smile. And there is a question about sexuality, my body having time and interest in sexuality. And that's on your actual handout. And that's a really important question that has to do with stress levels and self-assessment. Knowing yourself, make good decisions, as we talked about, less work. Very briefly, this is a framework that we developed. It emerged out of the years of offering self-care mentoring for our healthcare providers coming to mentor with us on site, and now who come to mentor with us via telemedicine anywhere in the country when they want to come and learn how to offer telemedicine and how to do functional medicine via telemedicine virtually. So these are the components for being well as a healthcare provider. And an example of mindset that I always like to use is, what does that sound like when you talk to yourself? I have the inner resources I need in this moment. I feel cared for. And some examples of emotional health, like I speak up for myself. I give and receive. I can live with an open heart, a clean heart. For community, I like to term that as connecting with one's body, connecting with the earth, connecting with our family, and also connecting with all loved ones or colleagues, our peer community, feeling affirmed, and knowing that you have the support that you need. If you're in trouble, you have someone who's there for you. This is a tool called a Tetlow 10. Some of you might have heard about this. We did an IFMCP webinar. And a Tetlow 10 is basically writing down for yourself some things that you need. They can be actions, for example, going to bed at a certain time. I have examples of when I first created this, what are some examples of things I might need to do for myself, and attitudes, ways of thinking. And these are the things that if you were to do them, you would feel like you were at the center of your life. So this is a tool. When I did the webinar with Dan in January, he said, well, Georgia, how often should people do a Tetlow 10? Just to sort of identify the key things for themselves. And I said how frequently back then, but I'd change it for the pandemic. You could do this and update it every 2 weeks because things change so much. Our needs change. What's asked of us changes. The terrain changes. Sometimes we're going back to the office and figuring out how to do a pandemic appropriate and safe work environment. I would recommend doing your Tetlow 10 as frequently as every 2 weeks, and then you can make it less often as needed. So just a quick summary, just to say, here are the handouts that are available to you as part of the session. The self-assessment we went over, the blueprint grid, so you can actually read it and not have a magnifying glass to see what those solutions are. the framework, which talked about mindset, emotional health, and community. There's a weekly schedule where you can actually look at your week and figure out when you might put things in your schedule. The important thing for a cash practice and for any healthcare provider that I've ever worked with is to not plan your day. You plan your week. And please visit our website, see what we do for our upcoming current events, see the resources that we offer, including we have short meditations that are for healthcare providers. There's 5 minutes, 10 minutes, something that you can do in the morning, you can listen to and center yourself before your day, your patient care. We have pocket guides that talk about modalities like acupuncture and just explanations, but they're also wonderful resources for healthcare providers and for patients. And you can also talk with me if you're interested in any mentoring. We have a way to do that. And I also welcome people who are in a transition. Sometimes mentoring is not right for you and you're actually looking to have a conversation. I enjoy teaching. I enjoy listening and being of service. And it's something that we all need right now in the pandemic. Absolutely. So just moving right through this, I'd just like to share in summary, I think we've covered these items, and I want to appreciate your time and that you've listened to all of our speakers. Thank you so much. And we thank you as a team, and we hope to be whole very soon as a team. And I appreciate your spending this time with me. Take care.